My name is Dr. Hatim Husain, and I'm a thoracic oncologist practicing in the academic medical setting in Southern California. Throughout my career, I've been involved in many biomarker-driven clinical trials and publications, and am passionate about educating other clinicians about the value of comprehensive genomic profiling, as well as the importance of a new biomarker called ctDNA Tumor fraction. Many of the patients that I treat have advanced non-small cell lung cancer. Through comprehensive genomic profiling, or CGP, up to 77% of these patients are found to carry a genomic alteration that is driving their cancer. Many of these driver mutations can be targeted therapeutically, which makes CGP an essential tool to match patients to targeted therapies. When I started practicing, CGP was limited to tissue-based testing. However, over the past decade, the availability of liquid-based CGP, often referred to as liquid biopsy, has revolutionized our ability to find genomic drivers for patients who don't have tissue available for testing. One critical factor when performing CGP testing is ensuring that there is sufficient tumor tissue and/or DNA to reliably detect potential driver alterations. When tissue is readily available, we can easily discern the amount of it that is tumor-derived by looking under a microscope. With liquid biopsy, however, it isn't that simple. We can't just look at a tube of blood to see how much DNA is circulating in blood and how much of that is tumor-derived. This limitation created hesitation and uncertainty around liquid biopsy for years within the oncology community. When we received a negative result on liquid biopsy, the question became, is the negative result truly driver negative, or is it negative because the patient's tumor isn't shedding enough DNA into the bloodstream? I have collaborated with scientists at Foundation Medicine over the past few years as the innovative biomarker ctDNA Tumor fraction has been validated to address this question and bring clarity to negative liquid biopsy results. ctDNA Tumor fraction, reported by FoundationOne liquid CDX testing, estimates how much of the total cell-free DNA in a liquid biopsy is tumor-derived. ctDNA Tumor fraction from the Foundation Medicine test accounts for several different components to increase accuracy. And those include aneuploidy, verinal frequency, fragment length information, clonal hematopoiesis predictions, and known tumor-associated alterations. The combination of these components ensures a more accurate determination of the amount of ctDNA in a sample than VAF alone. Accurately measuring ctDNA tumor fraction is critical to determining next steps when you receive a driver-negative liquid biopsy result. FoundationOne liquid CDX has defined a cutoff to distinguish low and high ctDNA tumor fraction to guide clinical decision-making. If a negative liquid biopsy has low ctDNA tumor fraction, follow-up tissue testing is warranted. If a negative liquid biopsy has high ctDNA tumor fraction, you can have confidence in the results and in treating for driver-negative disease. This can help us avoid taking a patient to the operating room unnecessarily to get tissue for additional testing. I hope that you, like me, appreciate the clinical value that ctDNA tumor fraction with a defined cutoff to guide clinical decision-making can bring in this new era of precision oncology care. Thank you.